Good morning, everyone. Good morning, leaders. I hope everyone is doing great. It is Monday once again. Today, I'm going to do a short training because unfortunately, sabotage, leaders, sabotage. Okay, thank God. Okay, I am audible. So let us call leaders. Okay. Hey, finally, technology. So, good morning. Like, I cannot believe today's sabotage. Eh? Some more sabotage. Good morning, everyone. Today's training, I am really going to try and keep it short. Uh, I'm, I'm a little, yeah, I'm a little tired. I was training today in Bramfontein. So, yeah, good morning, everyone. Good morning. We will start shortly. Can you please share the link in your respective groups with your partners and so on and so forth? Today we are discussing autism. I also wanted to discuss something else, but I think that one we will touch on it a little bit. Thank you, Coach Z. You really saved my life, and teamwork. Hi. No, don't buy that. Teamwork makes the dream work. Coach Z, you saved my life. Thank you, my angel. You saved my life. You just must know this thing is making noise now. Good morning, everyone. We will be starting in a few minutes. Can we please share the link with leaders? Today we're discussing autism. All right, today we're discussing autism. Let me see. Let's please share the link with our respective partners. We'll start in like 2 minutes just to get the numbers going. Good morning, everyone. I hope everyone is doing great. Let me go back. Where was I? Ah, yeah, no, technology. Good morning, everyone. Good morning, Lida Bolanle. Good morning, Sir Richard. Good morning, good morning. I hope everyone is excited. It's a beautiful Monday. It's the 28th, right, of March. And yeah, today's training, I am going to try and keep it short due to unforeseen, circumstances. I will just touch. Let's see. I hope everyone is excited. Everyone is okay. Good morning, Dida Maputi. Good morning. Yeah, today's training is going to be a bit short. Prof. Mankolo. Good morning, leadership. And then we will start in a minute at 1:15. Because wow. And then my mouse. I don't know what's happening with my mouse as well. Sure. I hope everyone is excited. We are about to start. We're now counting the seconds. It's a countdown now. It's a countdown. Let me see if I can do something I want to do. Welcome, little Rosari. Training hasn't done yet. We are about to start though. Oh, leaders, I'm telling you, the mouse. I don't know what's wrong. I think I should now get that mouse, the old mouse. I'm gonna get myself the old mouse. I'm telling you, I cannot struggle like this. Ah, wonderful. All right, let us begin. So we are starting with to speak about Autism today. Hello, Lida Mbiana. I hope everyone, as usual, as much as I say, I'm gonna try to keep this short. Ooh, even my voice is gone. We're celebrating on Saturday. My voice is still gone. Um, please have your pens as usual. Please have your pen, your books, as this is training. So, ladies and gentlemen, my name is Pulane, your global product specialist, all the way from South Africa. Today is the 28th of March, and thank you so much for really being here with me. I do appreciate your attending the training. Training is very important. Training is extremely important. So, my leaders, let's discuss autism first. Do you know of anyone who has autism? First question. The first question. Do you know of anyone that has autism? Yes, no. All right. So while I'm waiting for you, um, let's speak a little bit about autism. Actually, we need to speak about autism because on the 2nd of April, which is in a few days, it will be World Autism Day. All right, it will be World Autism Day. Prof. Mankola, I remember you asked me about autism. Ne? I think last week I made a mistake. I said I think you were asking me about Down syndrome, but I think it was autism that you asked me about a few months ago. So today we're speaking about autism. What is it? So autism spectrum disorder. That's the correct name. Autism spectrum disorder is a condition related to brain development. Morning, product specialist Tula. So, autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. The disorder also includes limited and repetitive patterns of behavior. Yes, correct. Code Z, I think it's still you. It's called autism spectrum disorder. That's the correct name. So, like I said, the disorder also includes limited and repetitive patterns of behavior. Kana, why did I not share screen? I also don't know. Remember me, I love to share the screen. Eh? I love to share screens because I want you to take screenshots. It's easier for you. Good morning, Dida Hamim. Good morning, good morning. So let's share the screen. Hey, sorry, man, I forgot. I hope we're together now. Okay, looks like I'm winning. Okay. All is well, all is well. So autism, the term spectrum in autism spectrum disorder refers to the range of symptoms and severity. So it's got degrees, like many other illnesses. Autism spectrum disorder includes conditions that were previously considered separate. There's autism, there's Asperger's syndrome, there's childhood, there's integrative disorder, and an unspecified form of pervasive developmental disorder. Oh, I can't zoom this one. Some people still use the term Asperger's syndrome, which is generally thought to be at the mild end of autism spectrum disorder. Autism Autism spectrum disorder begins in early childhood and eventually causes problems functioning in society. Welcome to them below. So problems in society like socially, so social awkwardness, so to speak, in school and at work. For example, ladies and gentlemen, last week I had the privilege of going to, I'm not going to name the school, but I had the privilege of going to a ECD center, early childhood development center, and I actually saw a child with autism. All right, and the way the principal was speaking about this boy, like we couldn't even tell that he actually had autism until the principal actually called the child and said, "Hey," he was sitting at the back. "Hey, come here." And then we saw with the way he's walking that, oh, there's a bit of an issue here. So yeah, that was something quite interesting for me last week Thursday. Some people use, okay, there I said autism spectrum disorder begins in early childhood, like I said, and eventually causes problems functioning in society. Often children show symptoms of autism within the first year, so the first year of birth. A small number of children appear to develop normally in the first year and then go through a period of regression, so they go backwards, between the ages of 18 and 24 months of age when they develop autism symptoms. So that's something that you also need to write down between period of regression between 18 and 24 months. While there is no cure for autism spectrum disorder, intensive early treatment can make a big difference in the lives of many children. What are the symptoms? Some children show signs of autism spectrum disorder in early infancy, such as reduced eye contact. Yeah, that's true. I've seen that a lot. Reduced eye contact. No, now I'm talking about contracts now. Oh my goodness. Reduced eye contact. Ne? Lack of response to their name or indifference to caregivers. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose language skills they've already acquired. Signs usually are seen by the age of 2 years. I hope you're taking screenshots. Ne? I'm reading directly from a website, Mayo Clinic website. So yeah, please take please take screenshots, leaders. Each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. Some children with autism spectrum disorder have difficulty learning, and some have signs of lower than normal intelligence. Other children with the disorder have normal to high intelligence. They learn quickly, yet have trouble communicating and applying what they know in everyday life and adjusting to social situations. Because of the unique mixture of symptoms in each child, so it's a case by case type of thing. Severity can sometimes be difficult to determine. It's generally based on the level of impairments and how they impact the ability to function. Below are some common signs shown by people who have autism spectrum disorder. So, this is very important. Social communication and interaction. A child or adult with autism spectrum disorder may have problems with social interaction and communication skills, including any of the following: failing to respond to his or her name, appear not to hear you at times. So it's like they're ignoring you. No, they're not. It's autism. A form of resist cuddling and holding and seems to prefer playing alone, retreating into his or her own world, has poor eye contact and lacks facial expression, doesn't speak or has delayed speech, or loses previous ability to say words or sentences. They can't start a conversation or keep one going, or only starts one to make requests or label items. The next point, speaks with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech. Other other pointer, repeats words or phrases verbatim but doesn't understand how to use them. So they repeat words or verbatim means you repeat them exactly, but they don't understand what they're repeating back to you. Doesn't appear to understand simple questions or directions. They don't express emotions or feelings and appear unaware of others' feelings. They don't point at or bring objects to share interests. Inappropriately approaches a social interaction by being passive, aggressive, or disruptive. Has difficulty, last pointer, has difficulty recognizing non-verbal cues such as interpreting other people's facial expressions, body postures, or tone of voice. Are we together, my leaders? So that was the social communication and interaction. So they lack what we would class as this is what we normally do. Right. What are the patterns of behavior? A child or adult with autism spectrum disorder may have limited, repetitive patterns of behavior, interests, or activities, including any of these. Number one, performs repetitive movements such as rocking, spinning, or hand flapping. Performs activities that could cause self harm, such as biting or head banging. Yeah, that's serious. Develops specific routines or rituals and becomes disturbed at the slightest change. Ladies and gentlemen, This is serious. I've seen a couple of adults with this disorder. All right. Has problems with coordination or has odd movement patterns such as clumsiness or walking on toes, so like a ballerina, and has odd, stiff or exaggerated body language. So it's either they do it too much or they don't do it at all. They are fascinated by details of an object, such as the spinning wheels of a toy car, but don't understand the overall purpose or function of the object. Is unusually sensitive to light. All right, so they've got photophobia, unusually sensitive to light, sound, or touch. Oh, now sound. There's something called misophonia that I discussed with my first specialist a couple of months ago. Okay, so they are unusually sensitive to light, to sound, or touch, yet may be indifferent to pain or temperature. Wow. They don't engage in imitative or make believe play. So this would normally be like normally for teachers, whether it's an ECD center or it's at primary school, high school. They don't take part in because normally in early childhood development there's a lot of make plays, role playing and acting, and so they're not into that, some of them. Fixate on an object or activity with abnormal intensity of focus. They have specific food preferences, such as eating only a few foods or refusing foods with a certain texture. And I thought I have OCD. As they mature, some children with autism spectrum disorder become more engaged with others and show fewer disturbances in behavior. Some, usually those with the least severe problems, eventually may lead normal or near normal lives. Others, however, continue to have difficulty with language or social skills, and the teen years can bring worse behavioral and emotional problems. So, now when to see your doctor? All right, with babies develop at their own pace, and many don't follow exact timelines found in some parenting books. But children with autism spectrum disorder usually show some signs of delayed development before the age of 2. If you're concerned about your child's development or you suspect that your child may have autism spectrum disorder, discuss your concerns with your doctor. The symptoms associated with the disorder can be linked with other developmental disorders. Signs of autism spectrum disorder often appear early in development when there are obvious delays in language skills and social interactions. Your doctor may recommend developmental tests to identify if your child has delays in cognitive, language, and social skills. So now, if your child doesn't respond with a smile or happy expression by 6 months, some of the signs. So if your child doesn't respond with a smile or a happy expression by 6 months, if they don't mimic sounds or facial expressions by 9 months, so you see, this is specific. If a baby doesn't babble or coo by 12 months, remember babies have their own language. So if they don't do that, we know how babies talk. So if they don't do that by 12 months, please, we need to see a doctor. They don't gesture, such as point or wave by 14 months. I mean, we all know that babies are very inquisitive. Oh, babies are very inquisitive. So if I mean, by the time it's what, around 4 months, when you put something there close to them, they already want to grab it. 6 months, they already want to grab it. So if they don't do certain things that you know that, okay, a baby by this month, they should be doing this, please consult your doctor. If they don't say single words by 16 months, please, doctor. If they don't play make believe or pretend by 18 months, if they don't say two-word phrases by 24 months, and the last one, if they lose language skills or social skills at any age. So that one is broad. The last point, my leaders, are we together? Are we together? I just want to see diagnosis and treatment quickly. Diagnosis, as you can see, I'm reading from Mayo Clinic now. So your child's doctor will look for signs of developmental delays at regular checkups. So the main thing is development. Okay, development. If your child shows any signs of autism spectrum disorder, now we're seeing adverts. We don't want adverts here. We need training. If your child shows any symptoms of autism spectrum disorder, you'll likely be referred to a specialist who treats children with autism spectrum disorder, such as a child psychiatrist. Thank you, Sir Richard. Or a psychologist, a pediatric neurologist, or developmental pediatrician for an evaluation. I am so blessed, my leaders, to to have a mother who is also she's a child specialist. She's a lot of things, but now that we're talking about pediatric, she's taught me a bit about, you know, what she's seen with kids and development. So I'm so glad that, we're doing this today. Okay, so because autism spectrum disorder varies wildly in symptoms and severity, making a diagnosis may be difficult. Remember that. There isn't a specific medical test to determine the disorder. Instead, a specialist may do the following. Let me see how many points. Okay, 2, 4, 6. Okay, first one. The specialist may observe your child and ask how your child's social interactions, communication skills, and behavior have developed and changed over time. Give your child tests covering the following: hearing, speech, language, developmental level, social and behavioral issues. The third one, present structured social and communication interactions to your child and score the performance. And then use the criteria in the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. Thank you, Leader Hamim. And then include other specialists in determining a diagnosis. And then lastly, recommend a genetic testing to identify whether your child has a genetic disorder such as Rett syndrome or Fragile X syndrome. There's a lot of these things. Treatment, the magical word treatment. No cure exists for autism spectrum disorder. No cure. And there is no one size fits all treatment. So this reminds me of what we did last week, which was what was it? World Down Syndrome Day. World Down Syndrome Day when I was training on Down syndrome. So there's no cure that exists for autism spectrum disorder. There's no one size fits all treatment. The goal of treatment is to maximize your child's ability to function by reducing autism spectrum disorder symptoms and supporting development and learning. Good morning, PS Rifule. Early intervention during the preschool years can help your child learn critical social, communication, functional, and behavioral skills. The range of home-based, listen to that, the range of home-based and school-based treatments and interventions for autism spectrum disorder can be overwhelming, and your child's needs may change over time. Your healthcare provider can recommend options and help identify resources in your area. If your child is diagnosed with autism spectrum disorder, talk to experts about creating a treatment strategy and build a team of professionals to meet your child's needs. Now, ladies and gentlemen, the other thing that we were made aware of about autism is that you need to find a teacher, especially in early childhood development, a teacher that has the skill to teach a child with autism. This is why you need the government, the South African government, this year they're very strict. They're closing all the schools. Actually, since the end of last year, they're closing all of the schools that don't have the correct papers when it comes to early childhood development. Because with early childhood development, the teachers are taught all of these things. All right. Treatment options may include behavior and communication therapy, educational therapies, family therapies. That's very important to include, make it an inclusive therapy session. Other therapies, this is depending on your child's needs. Medication as well, but no medication can improve the core signs of autism spectrum disorder, but specific medications can help control symptoms. For example, certain medications may be prescribed for your child, um, if your child is hyperactive. Antipsychotic drugs are sometimes used to treat several behavioral problems, and antidepressants may be prescribed for anxiety. Keep all healthcare providers updated on any medications or supplements your child is taking. Some medications and supplements can interact, causing dangerous side effects. See why this is so important? So, managing other medical and mental health conditions. In addition to autism spectrum disorder, children, teens, and adults can also experience the following medical health issues. All right, children with autism spectrum disorder may also have medical issues such as epilepsy. Remember, they also bang their heads, some of them. All right, so that is dangerous. Sleep disorders, limited food preferences, or stomach problems. Ask your child's doctor how to best manage these conditions together. Secondly, problems with transition to adulthood. Teens and young adults with autism spectrum disorder may have difficulty understanding body changes. Also, social situations become increasingly complex in adolescence, and there may be less tolerance for individual differences. Remember, they sit in their ways. Behavior problems may be challenging during the teen years. Are we together? Leader J, are you learning leadership? Sorry, am I making you tired? Other mental health disorders. Teens and adults with autism spectrum disorder often experience other mental health disorders such as anxiety and depression. Your doctor, mental health professional, and community advocacy and service organizations can offer help. I love this part. Now, planning for the future, what can you do? Children with autism spectrum disorder typically continue to learn and compensate for problems throughout their life, but most will continue to require some level of support. Planning for your child's future, planning for your child's future opportunities, such as employment, college, living situation, independence, and the services required for support, can make this process smoother. Now, I have touched a little bit on autism sometime last year, and I actually asked the leaders to actually check this other movie that explains autism so well. I'm still on that. There is a movie called The Accountant with Ben Affleck. So pretty please, my leaders, if you know somebody with autism or you want to learn more, please watch that movie, especially if you're an action junkie like myself. So watch that movie. It explains autism so well because it's him and his siblings that yeah have certain conditions. So it's so nice to actually see it and how they overcome. All right, my leaders. So now remember, autism is all about it's related to brain development, right? Developmental stuff. So in long reach, the products that you can recommend, but remember, provided that the child is at least 12 years, all right, and above, okay. Obviously, I always go to berry oil. Berry oil is brain food. Berry oil has got all the essential omegas, omega fatty acids. Berry oil has folic acid. It's great for DNA repair and support. It's also great for development in general. So if you've got somebody that has a child, maybe a teenager with autism, berry oil number one. Okay. Let me say number one is actually our cheese. Actually, remember we need to detox for 3 days prior to starting with the supplement that they work to their optimum. So what you need to do, you need to recommend either the green tea or the brown tea. By the way, our teas are also very good for brain power. Okay, so they are detoxing and they're also getting brain power one way or the other from the tea. Then they can go to our berry oil. You can also recommend the alkaline pickup. We know the alkaline pickup is very good for the brain. It's got zinc, got so many other micronutrients. So those are the three that you can recommend. Any of our teas between green tea and brown tea, please not pink tea. So green tea, brown tea, berry oil, and the alkaline pickup. You see why we say the alkaline pickup and the berry oil are a must-have. My leaders, are there any questions before I move on to the next I'll just make it short, because I wanted to have a guest here with us. Oh, what did I do? I did something. Hey, I did something. Pulane did something. Hey, my leaders, are there any questions? Are there any questions on autism? Is there somewhere where you're not clear? I hope I was clear enough. Hello, hello. Anybody there? I'm gonna have to do this. Okay, Rosari. When a child is under the age of 12, rather half the dose. So you can rather recommend they take one berry oil twice a day, because remember we take three in the morning, three at night. So rather they take one berry oil, one in the morning, empty stomach as usual, and one at night before they eat dinner. Okay, Leader Rosari? And remember, with autism, remember that it varies. There's some that is mild, and then there's some that like really hectic. So yeah, we really need to also keep that in mind. And I remember a couple of years ago, SD Noctula was also asking me the same about the berry oil, and um I told her, no, my SD, your child is under 12, one berry oil, two berry oil, so one morning, one night, and it really helped. I think, yeah, her small daughter. So yeah, our products really do work. We must just um, recommend them correctly. Remember, there's also hormones. There's this thing called hormones. Yeah. So I can't get into that now. Yeah. So Lila Rosad, I think last time you also asked a question and I logged off, and unfortunately I was busy. You were the one asking if a child under 12 cannot drink our teas. Am I right? So yeah, I think it was you, Lida Rosari. Between you or Bolanle. So what happens is with our teas, rather if a child is under 12, one small cup a day is fine. Okay, one like 125 ml cup is fine. Um, Even if you do it on alternative days, like one today, you skip the next day, on alternative days. Okay, because unfortunately, the lifestyle that we live in, the environment that we live in, doesn't say you are under 12. It will affect us the same way, toxins are everywhere. So let's rather protect ourselves, but let's also be mindful how we do it for our children under the age of 12. Is that all, my leaders, that you wanted to ask? I don't know how I managed, ne? I did something here. I don't know how I managed to do that something. And now I don't know how to send this here. This is just, yeah, today's amazing. So my leaders, sorry. Yeah. So my leaders, I'm going to touch a little bit on this. Oh, the other thing for the theme. Where is the theme? I just want to give you the theme for this year's Autism Day. Ah, where is the theme? Got it. So the theme, let me do this, copy and paste it that everyone sees. The theme of World Autism Day is the transition of adulthood. Remember, they said it's very difficult for them for the transition. Remember, they sit in their ways. The body changes and what have you not. So it's a bit difficult for them. Okay, let me just close this. Yeah. Now I have to fetch you. Where did you go? I don't know what this thing did now. Technology, guys. We roll with the punches. There it is. Wow. Yes. How today is the first. That's the theme, the transition of adulthood. That was also the theme for last year. And I don't know how to go back to this thing. So, my leaders, there's no questions thus far. Everyone happy. All right. I'm going to. I don't know why this thing is did what it just did, and I don't know how I did it as well. I don't know. I don't know. Someone decides to call me while I am in training. So, my leaders, we're together now. Everyone is happy regarding autism and the products that you can recommend. Remember what let's see, with the treatment, it is about reducing. There's no known no known cure for autism. Yeah, you'll see my screen is funny. I don't know what happened. It really went down. I don't know what happened. So there is no cure. So ladies and gentlemen, now we're moving on to endometriosis. So, but March is endometriosis month. I'm so sorry. I was just busy with with the graduations that I couldn't fit it in. We together. Thank you, Leader Hamim. So endometriosis. I'm just going to touch a little bit on it, not too deep, uh, because I want a lady who actually has it to come onto the program and speak about it. So I will touch on it a little bit. I just wanted you to be aware of this day. Let me see if I can. Okay, there you go. So endometriosis is bits of the uterine lining, also called endometrium, or similar endometrial-like tissue, grow outside of the uterus on other pelvic organs. Outside the uterus, the tissue thickens and bleeds, just as typical endometrial tissue does during menstrual cycles. I hope you can see the picture. No? This picture, I think it's clear. So there's the endometrium. So there's endometriosis on the fallopian tubes. I hope you can see it here. Yeah, I see my cursor is moving. So here it is. So that's what it means. All right. So bits of the uterine lining or similar endometrial-like tissue grow outside of the uterus on other pelvic organs. And ladies and gentlemen, this is extremely painful. So, endometriosis is an often painful disorder in which tissue, similar to the tissue that normally lines the inside of your uterus, grows outside your uterus. Endometriosis most commonly involves your ovaries, fallopian tubes, and the tissue lining your pelvis. Rarely, endometrial like tissue may be found beyond the area where pelvic organs are located. With endometriosis, the endometrial-like tissues act as uh, endometrial tissue would. It thickens, it breaks down, and bleeds with each menstrual cycle. But because this tissue has no way to exit your body, it becomes trapped. When endometriosis involves the ovaries, cysts called endometriomas may form. Surrounding tissue can become irritated, eventually developing scar tissue and adhesions. Bands of fibrous tissues that can cause pelvic tissues and organs to stick to each other. Yeah, to stick to each other. Oh, now I talk as if there's a comma. So sorry. Let me read that again. Surrounding tissue can become irritated, eventually developing scar tissue and adhesions, bands of fibrous tissues that can cause pelvic tissues and organs to stick to each other. Oh my word. Imagine the organs sticking to each other. Endometriosis can cause pain, sometimes severe, especially during menstrual periods. Fertility problems also may develop. Fortunately, effective treatments are available. Ah, what are the symptoms? I'm just gonna end here. The primary symptoms of endometriosis is pelvic pain, often associated with menstrual periods. Although many experience cramping during their menstrual periods, those with endometriosis typically describe menstrual pain that's far worse than usual. Pain also may increase over time. So here are the common signs and symptoms. Painful periods, also known as dysmenorrhea. Pelvic pain and cramping may begin before and extend several days into menstrual period. You may also have lower back and abdominal pain. Pain with intercourse, so sex is painful. Pain during or after sex is common with endometriosis. And then the third, pain with bowel movements or urination. You're most likely to experience these symptoms during a menstrual period. And then the fourth, excessive bleeding. You may experience occasional heavy bleeding menstrual periods or bleeding between periods. That's called intermenstrual bleeding. Now, the lady that I'm going to bring onto the show, onto the training, I met her when we went to Vet University last week, Tuesday, with AC Vivian. They were talking about endometriosis, right? And this lady, so young, 24 years of age, she's a cervical cancer survivor. She's already gone through 6, 7 surgeries already at the age of 24. And now the cervical cancer is gone, and now she has endometriosis. And she said the problem was she was such a heavy bleeder that she had to use a tampon plus a pad, and she would change them every now and then. Imagine at the age of 24. She's young, 20, yeah, 24, 24, 25. Imagine. And then infertility, sometimes endometriosis is first diagnosed in those seeking treatment for infertility. Now, the other thing, her doctors also told her that she needs to have a baby. Someone know, like ASAP, because after they do surgery, the chance of her having a child are 0 to none. Then, other signs and symptoms, you may experience fatigue, diarrhea, constipation, bloating, or nausea, especially during menstrual periods. Now, my leaders, back to you. I don't want to say too much about it, but I just wanted to make you aware. Now, where did you go? There you are. I just wanted to make you aware about that March is actually endometriosis day. And the fact that, you know, they say they don't know what's the cause. So for ladies who may be suffering from this, the same what you call the same just like autism, okay? Green tea or brown tea, our berry oil, definitely our alkaline backup, and you can add our sanitary ware. Okay, you can add our sanitary ware. There's a lot of ladies that are suffering a hell of a lot. I was so shocked, seeing kids, that's with kids, man, 19 years, 20 years, 21, complaining about heavy bleeding. Oh, and this girl, she said she her periods, she would bleed 21 days in a month. So imagine 21 days. I mean, we're supposed to go 5, maybe 7 days maximum. And then this poor child goes 21 days and she has to wear a tampon and a pad and change it every now and then because the bleeding was just excessive. So, my leaders, we really do have a business case. Let's raise awareness about endometriosis, raise awareness about the autism, which is on the 2nd of April, and get our products to the people. We have we have a solution. Though for autism, and the Down syndrome, there's no known cure, but at least it will minimize the degree of the symptoms. So my leaders, that is all for today. The training was really short. We are like 44 minutes. Are there any questions? As I said, I'm not going to go too deep with endometriosis, but at least you have a good idea of what it is. and I've also given you account of someone that I met last week. Yeah, so unfortunately, my phone story as well is really not working in my favor, but I had the graduations to concentrate on. So yes, and we also say congratulations to our new product specialists, who are some of them are in this training. Yeah, congratulations to them. So my focus was on that graduation. So now I can focus on other things. This week I'm training physically in next to it, close to it. So are we? Do we have any questions, my dears? Training is over. Is there somewhere where you are not clear? Then we can call it a night. If there's somewhere where you are not clear, do you have any questions about a product? Maybe, but I would like questions that address this training first, and then afterwards, yeah, we can address other questions. Do you have any questions, my leaders? Okay, I see I'm still audible. I'm good. Okay, whilst you are typing, so my leaders, yeah, like I said, so today is the 28th of March. So you have a couple of days to raise awareness of endometriosis month because it falls in March, and you can advertise our sanitary wear, pads, panty liners, our teas. Our teas are very good for reproduction. Okay, and Idankadi, welcome leadership. When is the right time to use the longish panty liners in relation to the menstrual phase? Before ovulation or what time? Hey, this question has been asked so many times. My leader, that question, you should look at it in this way. If you are you planning to be pregnant or not? That question is actually a two-part question because the way you write is as if you're writing as if this person or maybe you wants to fall pregnant. Always remember our page liners have got magnetism. Okay, so Lilankadi, I just want you to be specific. Your question, is it for someone who's planning to have a baby? Lilankadi. Exactly, for someone who's trying to to conceive. Okay, so leadership. Um, I've actually even had health professionals look at this question. Now let's try to apply what we call common sense. Leader Malindi, welcome. I love your energy. So ovulation is what? Shedding of the egg, right? So meaning if you are using your pads or panty liners when you are not on your period, what happens? The egg is still there, right? There's the magnetism. I'm trying to try to make it easy for you. Then when you ovulate, the egg sheds, you go on your periods, right? Lidankadi, I don't know if you're following what I'm trying to say. Lidankadi, or am I being difficult? Yeah, sorry guys. Hey, yeah. My mind is still very much, up there. My mind is very much up there. Lidankadi, am I making sense? Yes, my leader. So these things, this is why, thank you, my angel. This is why we need so many leaders in the Product Specialist Academy because really, it will really what you call grow your business. It will also give so much hope to your what you call your clients, to your success line as well. You should have. I wish that we would have streamlined the what you call the graduations on Saturday, but unfortunately, yeah, actually couldn't. The product specialists, they say their business has really grown exponentially due to the product specialist academy. So yeah, leaders, no, it's a common question to the childbearing aged women. Leader Nkadi, now I'm confused. The first one you said, yes, for someone who's trying to conceive, and then now you say it's a common question to the childbearing age woman. Okay, so for women who still want to give birth, remember there are women who don't want to give birth of a childbearing age. So I'm not, we really, that's the other thing. We need not to be presumptuous. You need to ask what's called leading questions. That why are you asking this question? Are you planning for, is it family planning? Do you want to have kids in the near future or so? Or you don't want kids altogether? Leaders, leaders, I know of a few ladies in their 30s who are nowhere, they don't want children. They are of a childbearing age. Oh, hey, Dinaka, you see, my mind is now it's flying. Hey, I'm tired. This whole week I'm training yeah, in Joburg. This whole week. Physical classes. So hey, I'm so sorry. My mind is very yeah, especially after the graduations. We still have the high, the high. So thank you so much, ladies and gentlemen. Do you have any more questions regarding, the autism, the endometriosis? Though the endometriosis I didn't thank you so much, leadership. Though the endometriosis, I didn't get too deep in it, but at least we have an idea of what it is and what products we can recommend. There's far too many women that are heavy bleeders and they think it's normal. I have a friend who used to bleed 14 days in a month. She would go 7 days, maybe a few days would pass, about a week, and go another 7 days in a 30-day cycle. That's not normal. She thought it normal. She used to wear two pads and still blot and still find leakage. It's not normal. Now I've managed to, show her the quality pads, sanitary way of long reach. She changed to our pads in 2020. Now it's a thing of the past. She's turning 40 years. So she's been having this problem for wow, for a long time. Since she was around 15 and now she's turning 40, you know. Yeah, next year she's turning 40 actually, it's next year. So she thought it's normal. She used to roll around. She used to even miss school. How that's how bad her pelvic pains were due to the menses. So now she's changed to the long reach sanitary wear. She also uses her testimony is also on the long reach testimony page. She also uses our cordyceps coffee as well. She says it helps her a lot with the PMS. Thank you so much, Leader Rosari. Thank you so much, my great leaders. So, great leaders, we will catch up next week. Let me see next week what is happening. Okay, so next week, we are celebrating World Health Day, which falls on the 7th of April. So we will be talking about everything health. And then World Hemophilia Day falls on the 17th. Okay, so 17th is far, far, far. So next week we'll be talking about wellness. Yeah, now that topic I love a lot. I love wellness so much. My leaders, thank you so much. It's not even an hour, but we've really covered a lot of ground. So take our products to the people. Remember, I said our green tea, even brown tea, also very good for the reproductive system, very good for PMS, for pains. Alkaline pickup, remember, it's also good for autism, right? For the brain, remember, developmental issues. The zinc will help them, okay? the alkaline pickup, and then the berry oil. The berry oil also helps them. Remember, it's got the omegas, it's got the folic acid, also known as folate, which help brain food. And then for women, it also helps for PMS. A berry oil also has anti-inflammatory properties. So there's so many things to berry oil. I don't know why people don't. Guys, buy yourself berry oil. Thank you so much, Maman Khadi. Thank you so much, my leaders. We will catch up next week. So next week we're just talking about World Health Day. So we'll be touching on wellness holistically. That's now that's stuff that I love. Thank you so much, ladies and gentlemen. We'll catch up next week. Remember, I said 2nd of April is World Autism Day. I just touched on endometriosis because March is endometriosis month, actually. So just in passing that you can just allay. It's a unique selling point that, hey, did you know it's endometriosis month? By the way, this is what it is. And then, by the way, I've got products for you. That's a selling point. So, my leaders, thank you so much. We'll catch up next week. Thank you very, very much. Remember your wealth. Your health is your wealth. Drink your alkaline pack up and buy that berry oil. Bye.